Okay, hello everyone. Is everybody getting me through clearly? Okay, there we go. Yeah, just went live. Well, welcome to my second stream. Today I am going to be discussing various issues surrounding COVID-19, which obviously seems quite topical. And I have a good friend of mine on, Ollie, to speak with me initially, particularly about issues surrounding vulnerable people. So, Ollie, would you like to introduce yourself?
Hey, hi. Um, so my name's Ollie. I'm a counselling psychologist, um, or I will be when the degrees people hand me my PhD, my doctorate. I mean, and um, I have worked as a psychologist, like for the NHS and like various other companies as well. For a number of years, and I am also a quote unquote vulnerable person. I'm immunocompromised following like a couple of major surgeries. So, yeah, I think that's kind of the relevant information from a personal and professional perspective.
Cool, yeah. So, I'll, for anybody who doesn't know me particularly well, my background is in neuroscience rather than psychology, so Ollie is very much the expert here. Um, and I'm probably somewhat immunocompromised as a result of diabetes and also suffering some mental health stuff. So I think we've both had some personal experiences with isolation as a result of COVID-19,
Mm.
and that's the thing I wanted to talk about first. Um, what kind of specific challenges have you faced as a result of uh, the intersection between your kind of specific quote unquote
Mm.
vulnerability and the ongoing pandemic?
Um, I think it's really difficult because I live with my wife and she's sort of ordinarily be working. I mean, if the quarantine wasn't
Hmm.
on, so I think from my perspective, it's quite difficult because I think we need to consider the consequences of COVID-19 like systemically on entire systems rather
Right.
than from the perspective of individuals. So, for example, if there wasn't a quarantine in place, it would be very likely that Sabrina, my wife, would be called into work, and that would put us in quite a difficult position.
Yeah.
Um, and that's just something to think about because I think it's one thing. I think the initial strategy was to try and sort of shelter more vulnerable people. I believe the government said that at one point, but the issue is if you think about this from a systemic perspective,
Yeah.
that's nigh on impossible to do. Um, so that's been a big challenge because it's kind of I can do one thing. I'm perfectly happy to sit inside, particularly because I've just finished my doctorate. That's fine by me. But one of the other issues is kind of how you sell that to the people around you, um, and I found that really challenging actually. Sabrina and I started quarantining in God, when did like middle of February,
Yeah.
way
Same here.
a good
Yeah.
good couple of weeks before everyone else was because she got back from a flight from Boston, and I said, "So you've just passed through Heathrow," um, and I actually I said to her, "Please, can you stay with your parents for a week before you
Hmm.
come home because this would be a complete disaster." If you kind of bring it here, and I think I got some kind of maybe some judgment from people, but yeah, it's been difficult, like logistically, specifically. Um,
Yeah. Yeah, it's a real problem dealing with the fact that it's not just impacting you. As you say, I'm in a vaguely similar position in that if I just had to stay at home and not worry about anyone else, that's something I could probably do. But at least initially, there was the fact that uh, implicitly there's kind of pressure on people around me, um, my fiance Amy and my friends and so forth to take that extra level of care and to place more of a burden on themselves.
Mm,
Um, and in a somewhat weird coincidence, my fiance was in hospital just before the
mm,
pandemic really kicked off. So
mm,
we had a bit of an almost enforced quarantine
mm,
beforehand because we'd just gotten back from hospital, and neither of us was really leaving the house while she was recovering. So in some ways that was a little bit beneficial, but
mm.
the certainly the initial phases of it were quite scary because there
Yeah,
was that uncertainty as to whether we should be taking extra precautions, especially when the UK government was so indecisive about the initial shutdown.
yeah,
Um, it's and there's always that difficulty I find, as someone with a disability, and I think you're probably more kind of severely immunocompromised than me, so you probably feel this at least acutely. Is that, or I would guess, is that difficulty in balancing being appropriately cautious
mm,
and not wanting to, impede on other people's ability to have a good
yeah,
time and your own ability to have fun as well, because you've got to live your
yeah.
life ultimately.
Yeah, I feel that very strongly. I think more specifically as someone that's kind of grown up with like chronic health conditions, that's always something that you're weighing up. Is the fact that you have to be quite careful with things, but also the fact that I want to go out and apply for jobs and stuff, given all of the things I've just finished, and I want my wife to continue going to business meetings and things in London, but it's really tricky, and I think it's it's something that a lot of people take for granted. I've had people say to me, it's fine, like they can keep working. If they were to catch it, it would be nasty, but they'd
Mm,
recover. And I think for people with a chronic condition, and including myself, you just don't really have that luxury to be so blasé about it. Um, and it's hard.
absolutely.
It's hard because it's not just you; it's also like partners and family and stuff as well.
Yeah, if you start suffering, then they're going to suffer too.
Mm,
If you get it particularly badly, there's an increased chance that they get it, etc.
right.
And yeah, it's something that seems kind of easy to say when you're facing down a very low death risk, as
Mm,
most people fortunately are, or at least
mm,
most younger people. But I don't know, it's hard to uh, see the kind of government advice and the media reporting saying, "Oh, don't worry, it's very low death rate as long as you're not in one of
mm,
these groups." Being in one of those groups and saying, "Well, hang on a minute, it's not quite so trivial for me."
Yeah,
Um,
so I was kind of really I was shocked and disappointed with those kind of comments on a
mm,
number of levels. The first was from a statistical perspective. Like, actually, I think a large proportion of the UK has a pre-existing health condition.
yep,
Um,
yep,
I'm gonna pull a number out of thin air, but I think it's something like 25 to 30%. If you take into account all of the very long list of pre-existing health conditions.
yeah,
Um, so I think first of all that kind of comment is naive, and secondly, the other thing is that it almost felt as though that comment was being used to excuse the deaths of people, just to sort of make it more palatable.
yeah,
Um, and as someone that is immunocompromised, I find that like quite deeply disturbing, really, because it's not more forgivable because like an older person died or someone with asthma died. I don't find that a compelling argument. Um, so
yeah.
it was just really disappointing. I think it was Dominic Cummings that said in a meeting, if a couple of old people die, then so be it.
Oh, here we
I
go.
thought,
I've
yeah,
just gotten a chat saying apparently about 19 million are in some sort of vulnerable group, which is nearly a third of the
right,
UK's
yes, that's
population.
roughly a
So
third.
yeah,
Yeah,
um, and I'm not sure if I did see some things with that Dominic Cummings quote saying that it had been, uh, uh, wasn't exactly what he said or something like that. But even if not, I think it's a sentiment that kind of radiates off him.
Yeah,
Um,
yeah.
it's one of these, whether or not it was literally true, it's something you can very much believe his saying,
Mm,
and
yeah.
and I think it's an issue I um, kind of have a lot of problem with as a as someone who studied medical ethics a bit and someone who's interested in utilitarianism. That on the one hand, a kind of naive reading of sort of raw utilitarian calculus would be we absolutely need to prioritize, the most amount of life saved,
Hmm.
and if you've got one person with a chronic condition who has a 40% chance of survival and one person without a chronic condition who has a 60% chance of survival, on the individual level, that seems like a fairly no-brainer clinical decision.
Hmm.
Um, and to some degree, that's what triage is all about.
Hmm.
But when you have that decision being made individually, on thousands of times a day all over the world, it starts to, as you're saying, this kind of systemic effect
Mm.
is generated. And there's a particular case of this, a specific case of this, that's come up recently in the US, probably mostly due to socioeconomic reasons. African American people have a significantly higher rate of complicating comorbidities
Mm.
than than the population as a whole, or than white people specifically. Um, so if every primary care, if every physician working in the field makes that decision to prioritize, the 60% chance over the 40% chance,
Right.
then the practical consequence of that, with no, ill will whatsoever on the part of the doctors, these might all be, perfectly wonderful-minded, liberal, lovely doctors, whatever, but
Hmm.
without any ill will on their part, you've got a systematic um, deprioritization of people on the basis of race,
Yeah.
or at
Yeah.
least on something that correlates extremely strongly with
Yeah.
race. Um, and practically speaking, I'm not sure there's any difference. Um, so I guess it's a big question. I don't want to kind of put you on spot, but how do you think we should resolve these kind of conflicts between, raw prioritization versus assuring justice and equity in our healthcare services?
Laurie, that is a huge question.
I'm
There,
sorry. I
there are books written about this. Um, I don't really know because I think the the sort of rational, ethical side of me
Mm,
acknowledges that actually, allocating scarce resources on the basis of who's most likely to benefit from those resources isn't a terrible
mm,
system in
mm.
principle. And I have to say that sort of from a detached, rational perspective. Um, but then I think I can hold that position and also be a bit concerned about the consequences. Um,
Yeah,
However, I can't really suggest a better way of doing it. To be honest with you.
no, I do think it's a coherent position to hold. Um, like I say, you've got the kind of very naive utilitarian view of, we need to every act needs to balance out perfectly in the calculus based on my kind of first
Mm,
approximation. But I think so. When we talk about medical ethics, I know you know this, but for the purpose of anyone listening who doesn't, one of the four big principles of ethics, you've got, excuse me, burping on that. You've got autonomy, beneficence, justice, and non-maleficence, which is essentially make sure people can make choices, make sure medicine does good for people, make sure that it's applied with equity and in a fair manner, and don't cause people harm. Those are the kind of four canonical principles of medical ethics. And when we're discussing this, we're mainly talking about the justice issues. So the impetus to ensure that people have fair access to treatments.
mm,
And I think one can make a pretty strong argument, be it from a utilitarian perspective or deontological or even virtue ethics, if that's your flavour, that the justice offered, the equity improved by not purely prioritizing on the basis of clinical necessity, in every
mm,
single time, has utility in and of itself, and that it's worth the loss of, um, maybe a few hundred or a few thousand life years over the course of a pandemic,
mm,
um, in order to improve the kind of character of society, I suppose, in order to signal to not just vulnerable people, but anyone who might become vulnerable,
mm.
that they're not going to be tossed aside just because they've hit the kind of
Yeah,
booby prize in the genetic lottery, or just because
yeah.
they've gotten old, or whatever.
I think I think that's quite a good perspective. I mean, I think the other argument is that there are, a huge wealth of factors to consider when we talk about mortality rates for any
Mm,
illness. And I believe, um, off the top of my head, I think when this first started, a lot of these decisions were being made by hand by ethics panels. Um, and I would argue that they cannot crunch the amount of data required to make a utilitarian um, judgment on this. I wouldn't be surprised now if there was a more advanced algorithm they were using. Um, but at the I was certainly aware that at the beginning they were using just hospital ethics panels to make these decisions, and I
yeah.
think it's you know far too complex a decision to make by hand, or even in a room with 5 or 6 people, or however many people are on the board.
Mm.
So it's just worth bearing in mind.
Yeah, I think this is something we really need to let the literature, I say let the literature catch up. Obviously, there's decisions that need to be made now,
Yeah,
but to make any kind of really confident statement, I think there needs to be, as always, as both of us scientists, I'm sure we've repeated this many times, more research is needed, um, as always. And yeah, it's a certainly a decision that I don't envy medical staff having to make.
mm,
Um, I mean, I was saying this just before we went on the air, but I used to want to go into neurosurgery, and I am really thankful right now that I didn't. Not least because I would have gone on to develop diabetes, and then be in the position now of being a final year medic with
mm,
an inability to, safely contribute. So that would probably be even more frustrating. But if I had to go onto the front lines, I don't know how I could do it. It seems like an
yeah,
incredibly difficult
yeah,
task that we're asking
and
medical staff to do.
there's a whole host of personal worries, but
Mm,
there are also kind of societal issues around it as well. So one of my good friends is a nurse, and she's just finished her training, and
mm.
she was basically hitched into work at Guy's and St Thomas's front lines, and
Oh bloody hell! That's
she was every house that she applied to house share and rent, she was turned down. No one wanted to live with her.
just because she was a nurse.
Yeah, absolutely, just because she was a nurse.
And
Um,
yeah, how do you deal with that? It's because from the perspective of people taking it in, I can kind of understand not
right.
wanting to share, with someone who's got or almost inevitably going to get the plague. But again, it's a coordination problem.
Yeah.
The actions of individuals, none of whom you can really blame, all of whom are making kind of pretty reasonable decisions, gives rise to your friend being effectively homeless while trying
Yeah.
to fight this pandemic.
Yeah. And it is tricky because I held exactly the same position. I thought to myself, I sort of don't blame them,
Mm,
really. Um, However, on the other hand, I recognise that this is probably something that a lot of people face when they're renting or house sharing.
Mm.
Um, and it's kind of it goes back to the systemic kind of stuff that I was talking about, but also more logistical kind of issues as well. Like how do we arrange people, medicines and things like that, make sure that people are getting like the services and goods that they need.
Yeah, and it's something that I think some of it's almost certainly going to need government action, though the way that the way that world governments have been handling so far isn't very encouraging. I'm not sure if they can
Mm,
handle, housing everybody or providing support to vulnerable people at the same time as making a pig's ear of the pandemic, but of the actual health management. But yeah, perhaps there needs to be some kind of push for more people more non-healthcare workers, non-vulnerable people to start taking risks uh, to support the broader societal effort. Doing something beyond just clapping every Thursday. Not that. Oh shit! I missed that. um, well, I'm going to claim that my missing it was some kind of political statement about the collective action problem and how clapping isn't enough, but something like that. Um, but oh,
mm.
but yeah.
I
So sorry,
I
just
think
got a
one of the things that I
message.
particularly wanted to say was obviously that like for me there are a whole host of issues that I've had to kind of think about a
Yeah.
little bit, and one of them was medications. So I I received my vulnerable person letter proudly
Oh,
a couple
exciting.
of weeks ago. Yeah, very exciting. How long? Probably 3 weeks ago, I'd say.
Mm.
Maybe four. And I only just had a phone call from my GP, like asking me whether I needed any help with anything or medicines on Monday this week.
Well,
So
that's kind of terrifying.
I think the thing is that you can sort of notify people all you want,
Mm.
every day. But the fact of the matter is, it appears that the logistical side of things is just non-existent. Um,
Yeah,
I'm
it's absolutely broken down.
right. I was in a very lucky position that the renal team that I'm under for one of my conditions, like, just offered to post me drugs, which was fantastic, really, really useful. But otherwise, I would have been put in an impossible situation for the last couple of weeks. And the other thing is, in terms of like really simple things like grocery shopping, I can't go out. I also can't
Yeah,
get anything delivered because no one has any slots. And because everyone's oversubscribed, I mean, sort of Ocado and Tesco delivery, they're not taking on new customers, so I
yeah.
can't register and I can't actually get anything delivered. So guess I starve.
Oh Christ,
Um,
that's nightmarish.
yeah, it's just like all of this really difficult stuff that I
Yeah,
think it kind of makes you realize that actually I think beneath it all, this country runs a very tight, like difficult logistical ship. And when anything goes wrong, it really, really makes you realize that scary stuff can happen very quickly.
yeah, absolutely. And this is something that the chat brings up this important disparity in the number of kind of deaths as a result of COVID and excess deaths.
Mm,
And yeah, I suspect a lot of those are caused by these kind of issues. And I have to say,
mm,
I'm very fortunate in that Amy, my fiance, has really been on top of dealing with the kind of shopping stuff, and we did already have an account, so
mm,
we've been all right on that front. And I have a couple of really wonderful friends who've been going out of their way to, bring me supplies as needed. But including one who went out and got me a big can of petrol for my generator in case my fridge goes out, so that my
amazing.
insulin doesn't, because we've been having some power cuts recently.
Ooh,
Um, and similarly, I've been very lucky to have been paranoid enough to stock up insulin in case
mm,
of Brexit, that
yeah, yeah,
I have plenty of left over. But most people aren't as fortunate as me, and
mm,
you know, I I think it's fair to say that both of us are in relatively privileged positions, and yet, we're still facing up to some of these really quite concerning
Yeah,
breakdowns. And
I
you know, oh,
yeah,
sorry, go ahead.
it's kind of related to the Brexit thing, and what's coming up now was there was a rhetoric, back then people were saying don't worry, don't stock up on your medications, don't do anything rash like that. I obviously stocked up on my
Mm,
medications
yeah,
because I'm not foolish. Um, but the fact of the matter is
mm,
if I hadn't had the relationship with the team that I'm under at um, the renal team, and I hadn't kind of sorted out
mm,
delivery, I would have had 4 weeks of no medication. And if you don't take your immunosuppressants for a day, then you stand
yeah,
a not insignificant chance of going into organ rejection. So, what was I supposed to do? I, the sentiment sometimes that comes from people is completely at odds with like the reality of the actual situation. Um,
absolutely. And there's this, I think, this kind of perception that because maybe it's more likely than not that Brexit won't cause supply chain disruption, or the pandemic won't be that bad, or so forth, that because it's less than a 50% chance in people's minds, it's negligible,
mm,
when the outcome, even if it's a tiny chance, even if it's a 1 in 20 or a 1 in 100,
mm,
the outcome for people like us, and especially you, with diabetes, it sucks, but I don't go into full organ rejection that quickly. But generally, with vulnerable people, it can be a 5, 10, 1, whatever, very small
mm,
percentage chance of likely death, and that's not a chance you want to take. If
no,
you were had a 1% chance of being hit by a bus every time you crossed the road, you would be staying on the same side of the street most of the time.
right, exactly. Everyone does very small things every day to avoid marginal risks.
Yeah.
Um, so it seems utterly terrifying that those same people can turn around and say, "But don't worry about stockpiling your
Mm.
medication," which has a very very reasonable chance of leading to death if I don't take it.
Exactly.
Um, yeah.
And especially when you've got that increased worry of not only uh, the the risk of the direct crisis, disrupting supply and disrupting one's treatment, but
Mm,
the knock-on effect. What if, whether you're just saying what a tight ship
yeah.
logistically the country runs, and this is something that all across the West, with just-in-time manufacturing and
Mm,
delivery, all of our supply networks are these incredibly tightly tuned machines, but they're all extremely interdependent. And when we start
yes.
getting disruptions in one area, it can
Yeah.
cascade.
Yeah.
And I don't really want to pay much attention when the government's saying, "Oh, don't worry, we won't need a lockdown. It's all going to be fine. Stiff upper lip, all that. Don't worry."
Mhm.
Um, but not seriously making plans for what happens if there is supply disruption, and what happens
Yeah.
if
Yeah.
nobody's able to get to the supermarkets and there aren't enough delivery slots and all these sort of things.
Yeah. It's
Um,
scary. It is scary. It just raises questions I think a lot of people don't have to seriously grapple with in the same way. Food is one thing, but medications that you literally die if you don't take in a day or 2 days or whatever is
yeah.
quite another. I mean, maybe I'm over exaggerating. Like rejection is reversible. I could just take steroids, but whatever.
I mean, sure, but it's at very least not nice, and you go a week or two, and it's getting serious life threatening, I believe.
Yeah.
Not that I'm an immunologist or anything, but yeah. So chat is asking, are we likely to see a spike in ME as a result of the outbreak? I suppose as a psychologist and a neuroscientist, we're not completely unqualified to be tackling that question.
Uh, ME, as my understanding, is can be sort of a further complication of viral
Mm.
infection, I believe, or bacterial infection. So
Yeah.
it doesn't seem absurd to consider that. Um,
Yeah, I think part of the issue at the moment is this is something I'm gonna cover a bit more later. Excuse me. Actually, no, I'll go into it a bit now, because a bit later I'm going to be chatting about uncertainty in evidence.
Mm.
Um, but we do have, so there's some reports here with neurologists in Italy reporting about the potential for COVID-19 causing somewhat confusing neurological symptoms. It's not sure whether this is a bit of a coincidence uh, or the indirect or direct effects of the virus. Um, there's Amy has just posted the possibility of immune system effects causing increased likelihood of schizophrenia, and this is something that's very much an open question at the moment, and something that I find quite concerning. There are a variety of reasons to suspect that there might be neurological complications. The fact that it causes anosmia, lack of smell, and lack of taste could indicate neurological involvement. The gastrointestinal symptoms indicate that it's possible that there's involvement of the enteric plexus, the nerves that control the intestines. And there are a variety of immune effects and neuropathies associated with related viruses. Um, so I think there is a very real risk that we're going to be facing um, a, a a wave is probably over exaggerating. There's a good chance that actual severe instantiations of any of these possible conditions are likely to be rare, I would
Mm.
hope, um, though we have no way of being really confident yet. Uh, but I wouldn't be surprised if we see a rise in the rate of certain neurological illnesses.
Mm.
Um,
Mm.
and that kind of brings me back to a question I had for you, which I
Mm-hmm.
think we'll do before the kind of silver linings, is what do you have any predictions as far as the mental health challenges, either acute or chronic, that we're likely to see as a result of this pandemic?
I think acutely, like obviously in a state of heightened anxiety, there are going to be a lot of people that are suddenly going to present with that those kind of cluster of I hate saying the word disorders, but
Mm,
those
yeah,
kind of illnesses. Um, it's particularly around the issue of existential risk, which I think is something that a lot of people don't consider until they sort of have to. And we are most definitely in a situation where a lot of people have to
mm,
consider existential risk. So, and I say that from both an acute and a chronic perspective because this isn't something that's going to go away for a lot of people. I think,
yeah,
whether or not COVID-19 disappears tomorrow, it's kind of irrelevant. I think lots of people are going to be affected by death, directly or indirectly. And that's seriously, seriously challenging for people that haven't considered that before.
yeah,
Um, it's actually terrifying. And I also think on a more acute level, because of the current measures that we've taken, I think we need to be a little bit careful about kind of depressive symptoms. The fact that
mm,
people are losing routine, losing access to social networks, losing access to employment and all of the other structures that I'd encourage people to get involved
yeah,
with. If they were suffering from low mood. This kind of large scale disruption is is highly correlated to depressive and anxious illnesses, quote unquote. The only reason I'm saying it from that perspective is because I consider these very reasonable responses to the current situation, rather than some kind of
yeah,
diagnostic, some kind of anomaly. I would consider it um, almost completely reasonable and common among people to be feeling this way. And that doesn't dismiss the need for help, but it does kind of dismiss the idea that it's wrong or bad.
I I completely agree. I think that's an excellent take. Um, it, and this is generally uh, something that I have kind of a lot of personal issue with. Um, is that I'm very interested in existential risk, or I kind of have this kind of fascination with it. It terrifies me, and
Mm.
I think that broadly speaking, existential risk is the biggest issue that we face as a species, and the one that we should be, or at least the one where there's the biggest disparity between our interventions, how much effort we're putting in,
Mhm.
and how important it is.
Mhm.
Um, so, on the one hand, there's this kind of, uh, as you were saying, the trying to deal with something that's really terrifying and becoming depressed and anxious partially as a result, but then struggling with how to conceptualize that because it's not clear that it's a uh, fundamentally dysfunctional response
Mhm.
to that knowledge, to
Yeah.
that information.
Yeah.
You know, if I truly believe that there's a good chance that the world is going to end, and I have good reasons to believe that. I don't believe that it's more likely than not. I think it's probably about a 1 in 6 chance over the next century, but big enough chance that it's pretty fucking terrifying,
Mm.
and I get depressed and anxious as a result. Is that wrong? Probably not. Is it
No.
worth pathologizing? That's a trickier question.
Yeah. So my political answer to that question is it's worth pathologizing as long as that means you'll be allocated the resources you need.
Mm, fair,
Um,
fair.
I it's difficult. So I should point out that there are lots of different factions within like practicing
Mm,
psychology right now. There's a big difference between counseling psychologists and clinical
mm,
psychologists. Traditionally, there has been, and I think this is diminishing slightly. But what traditionally has been the case is counseling psychologists are interested in doing therapy and a bit less interested in diagnostics and assessments and things like that. Um, I will stress I use the word traditionally. I don't think this is the case so much anymore. Whereas clinical psychologists are more interested, or have been typically more interested in assessments and diagnostics and things like that. So my angle, my training was very much interested in almost flippantly not caring whether someone is affected by what you could call a sort of diagnostic illness or not,
mm.
and instead just offering therapy and doing the best you can. And I think in this situation, the advantages of that system kind of become clear because we're not dealing with sort of quote unquote dysfunctional responses, I would say. Um, so it's tricky because to access a lot of services within the NHS, um, you need to have some kind of diagnostic label. Um, but then on the other hand, I think some of them are arguably inappropriate.
Yeah, I think that's again, I think that's a very good take. Ultimately, there's no point in pathologizing something if it's not going to help the patient to do so. But
Mm,
conversely, if it's going to help the patient, even if it's not, a traditional disease state or whatever, it's probably worth using medicine as a tool to,
yeah, yeah,
I personally I have no problem with people who aren't quote unquote mentally ill,
mm,
going to see a counselor because it makes them feel a bit better. I think,
right,
I mean, personally, this is my transhumanist bias poking through. Personally, I think medicine should be in the business of improving quality and length of life, whether that's bringing people up to a healthy standard or pushing them beyond quote unquote a baseline healthy state.
hmm
Um,
hmm
but that's a bit of a, a different topic.
But I
Um,
think there's a lot to be said for that, and that kind of attitude is really important now in the current crisis. I think that people need to be more willing to um, actively pursue healthcare interventions even when things aren't particularly abnormal, because I
Mm.
think a lot of people are going to be feeling anxious, and that's not abnormal right now. And also, particularly when symptoms aren't at their most chronic or most severe, because you don't have to be in that state to seek, any kind of psychologist intervention.
Yeah.
Certainly privately, that's less true on the NHS, but actually are a couple of services that you can get in contact with, depending on where you live, of course.
What's the name of those, just in case anybody listening might benefit?
So, when I was working in Surrey, I've since moved, there were a number of charities that offered counselling. I worked for one called Oakleaf, which worked in and around Guildford and Woking, which was fantastic. So that's Oakleaf Enterprise. And then the NHS in Surrey and Borders also had an outpatient psychotherapy service, which was really bizarre
Oh
to
wow.
offer that kind of thing. Yeah, and it was classically Freudian as well. It was
Oh,
like a real
okay.
throwback, a real throwback.
Okay.
Just I was very very surprised to find such a thing. But the advantage of that service actually was that it didn't require a formal diagnosis, as far as I was aware. It was kind of for clients that were struggling with issues that were more uh, the kind of complex trauma side of things, where
Right, yeah.
a lot of really really tricky things had happened, but it kind of didn't fit a lot of other boxes.
Sure.
And that would fit in with, like, maybe let's say you've had chronic health conditions, you have lived through COVID-19, you're
Mm.
struggling with anxiety. It doesn't fit into a lot of other things,
Mm.
but you're just like really a lot of complex events have happened, and now you find yourself in this situation.
Yeah, and it's something that I think we can legitimately point towards as being a trauma in and of itself.
Hmm.
Even for people who, uh, and I'd say a good chunk of the sort of Western population, in terms of material comforts, has been very minimally affected by this.
Hmm.
Um, I said when I say a good chunk, I don't mean a majority, but a solid percentage. Anyone who's reasonably well off and has the money to not worry too much about employment and all this sort of thing. A lot of people have, in terms of comforts, gone through this absolutely fine, and yet I think it's entirely understandable for many of them to be severely psychologically impacted by this,
Hmm.
let alone the people who've been on the it's getting a almost mawkish phrase, but on the front lines, um, and the people who've been working their fingers to their bone with deliveries or logistics, the medical workers, of course, um, people like you and me with pre-existing conditions who are at greater risk, and yeah, it's truly going to be a generational trauma.
Yeah,
Um,
I think so. Because I think cognitively, like, we see trauma often in people cognitively when there's been some kind of challenge to, like, their kind of core
mm,
worldview. Not all the time, but it that comes up quite a lot as a typical precursor to trauma, is when there's been a large challenge to some kind of fundamental, like, view of the world. And, like, I think things like the 2007-8 financial crisis and
mm,
COVID-19 and things like that can be completely complete perceptual shifts for people, completely redefine how they view the world around them and society and how vulnerable they are. Um, that
yeah,
kind of stuff.
yeah, absolutely. Um, and yeah, so we've got someone in chat mentioning that for the first time in their life they're experiencing really severe fear
Mm.
as a result of the outbreak, and particularly worrying about the second and third waves
Mm.
of potential uh, reinfection of the population and potentially even reinfection of the same individuals, since we're still not particularly confident that that can't happen. Um, Subsequent to the initial lifting of a lockdown,
Yeah.
um, and and yeah, I think that's an entirely reasonable fear. Just
Yeah.
on the point of complying with, excuse me, with the government orders. Um, I'd say the first kind of thing to bear in mind is I'm not an epidemiologist. I'm not a trained medical professional.
Mm.
Um, I don't listen to me too much for advice. Um, when it comes to uh, government lockdowns, what to do when the time comes, if you'd like to talk about that when the time comes, I probably will be doing so, but it's really going to depend on the circumstances.
Yeah.
It's possible they'll be too um, reluctant to do so. I suspect not, but it's an incredibly difficult thing. I think the initial phases of both the UK and US have been offering some very poor government advice,
Yeah.
but there have been plenty of countries offering good advice. Germany, South Korea, Taiwan, real China. Um, all get good marks there. Sorry, just dropping my my Taiwan support power level there. Um, but yeah, when it comes to dealing with the second, third waves, it's going to be a wait and see approach.
Mm.
I but I share your concern, person in chat, Jagoshk, and um, yeah, I hope that contact tracing is taken more seriously. That's going to be
Yeah.
a
Absolutely.
necessary predicate.
Mm.
Um,
And it's particularly from the angle of someone that is immunocompromised. I
mm,
find the entire thing terrifying because in the back of my head, I think, fairly or unfairly, I don't know, but that the government's advice just doesn't really have my best interests at heart. So what do I do?
yeah,
Um,
yeah,
and what do I tell other people? Because other people can rightly turn around and say, actually, I'll be fine,
mm,
which isn't
mm,
incorrect, probably. Statistically, they're right, they're correct.
yeah, yeah,
I wouldn't play the numbers, but if they want to. Um, so it is really hard because at some point I think the government, maybe sooner rather than later, is going to turn around and say it's safe to go out to work. And what do I tell? What do I tell my fiance? Sorry, my wife. Why did I just say fiance? God, that's terrible. My wife. And what do I tell my dad? Who I'm
yeah,
living with at the moment.
yeah,
Don't go to work. Well, it's not even an option that most people have. So
yeah, exactly. Um, Similarly, my fiance, she is definitely still my fiance. Um, uh, when she goes back to work, uh, it's going to be a really difficult decision, and we're in
mm,
the relatively fortunate place that she has very understanding work, and she does medical research, much of which can probably be done remotely, and blah blah blah. Um, but for people who aren't in our relatively fortunate position, even we're going to probably end up having some challenges there. But people who aren't in that position, who have to go to work, um, and I'm especially thinking of people who have pre-existing conditions and who have to work themselves, who live by their own, who don't have extensive support networks. Um, with the government currently giving like basically no meaningful support to, or very little meaningful support to individual people, and mandating that everyone goes back to work at a certain point,
mm,
are they just going to have to give up on unemployment and hope they can survive on, rice and a bathtub full of water or whatnot?
mm.
It's going to be an impossible situation, and
There might be some interesting sort of psychological and sociological paradigm shifts as a result of this.
mm,
Just thinking off the top of my head about things, issues like UBI, um, and even less extreme measures like, once upon a time, people might have turned around and said, "There's no way they're going to work from home." They like to see people face to face. They like to go into the office, and they
yeah,
feel that's important. People that I've been talking to now have completely changed their tune and turned around and actually said that working from home is fine. And interestingly, they've noticed that I know it's a very difficult situation right now, but they've noticed that their quality of life has gone up massively because they're not commuting for 2 hours every day.
mm,
Plus, they're bumping into less people. they want to stop working and go outside, they can do that. Well, sorry, I live in the countryside, so it's fine here because I live in a field. I literally live in a field. Uh, Obviously not recommended if you're in London. But it's interesting that there might be huge paradigm shifts in people's attitudes towards work and what's considered acceptable and what isn't. And there will be positives and negatives to that.
Yeah, so this segues very nicely into the kind of silver linings I want to discuss at the end. Um, and yeah, I think one of the things that I'm feeling very positive about is the increased support for telework and
Mm,
the very, very rapid societal shift to more acceptance of um, VoIP calls as a means of meeting.
mm,
As someone who was pretty functionally housebound before the pandemic,
mm,
my social life has become a lot easier. Uh, Being able to get back in touch with friends, which obviously I had the technological capability to do all along, but there's more of a lower barrier to entry now in terms
mm.
of persuading one's friends to get on the call
Yeah, yeah.
and everyone uh, being prepared with their webcam ready and
Mm,
even one's parents having taken the time to learn how to use Zoom or Jitsi or
yeah.
whatever.
I actually think that the potential advantages of this are huge in terms of save time, save money, and also societal advantages for people that are housebound that can't leave the house for whatever reason. With the increased uptake of these kind of technologies, and I think almost more importantly, the fact that their kind of acceptability and their status within society has gone up, I
Mm,
feel as though it could be a really positive thing for a lot of people. Um, as you said, people would be more willing to hop onto Discord or whatever it is, and that's quite a major shift.
yeah, absolutely. And hopefully it'll also increase the robustness of things like the delivery networks as more
Mm,
infrastructure is put in, of online portals so people can do their banking and get benefits and all of these kind of
mm,
things remotely with greater ease.
yeah, yeah. I was listening to a really interesting podcast earlier that was talking about how the shift to like online banking and kind of more electronic transactions um, can be like a very positive thing for everyone.
Yeah,
Um, Although I also understand there are a lot of negatives for the homeless population. Separate argument, large things to be said about
yeah,
that. Um, but it's just interesting because if I'm cautiously optimistic that if the lessons are learned, there could be some very significant and potentially quite positive changes.
yeah. I think so too. And a part of me, the my kind of most optimistic take for COVID-19 is that hopefully, maybe it'll itself act as something of a not so much a vaccine as a variolation against the greater biological threats that we face.
Mm,
Um, so pandemics are something that I've been worried about for a very long time, and yeah, I don't want to be all. I told everyone so, but uh, and I'm mostly basing this kind of prediction off people far smarter than me, but I've been saying for years that we're going to face something like this, and when it initially hit, I was considerably more scared than I am right now
mm,
because for as bad as this pandemic is, there are certain features that make it considerably less bad than it could have been,
yeah, yeah, I agree with
and
that.
crucially considerably less bad than an engineered pandemic could be.
Mm,
Um, this is all a bit off topic, but uh, my sincere, sincere deep hope is that this god awful global event is going to put serious pressure on policymakers and bring it seriously into the public sphere to
Yeah,
discuss how we can
yeah,
minimize these risks in the future.
yeah. I agree with that. I agree. I cautiously say if the lessons are learned,
Yeah,
but um, if
if
that is fulfilled, then hopefully. I think you're right. It's better this than something that's 10 times more dangerous in 5 or 10 or 20 years time.
yeah,
Um,
yeah, this is fortunately this is not a uh, extinction threat. This is not an existential risk. Um, it is a global catastrophe, but with a bit of luck, we'll have, cases not stepping into the billions and deaths not stepping into the many, many millions,
mm,
um, which is, I guess, a silver lining. That counts.
Well,
I'm gonna
I
definitely
think
count
it's a
that.
silver lining that we can talk about these issues now more
Mm,
seriously,
yeah,
um, rather than this, as we just alluded to, happening in the future when potentially something more catastrophic has occurred.
yeah,
It
absolutely.
is a silver lining to say that people people might become more prepared in time
Mm.
because this has happened. Yeah, and there's the climate change stuff allegedly, which I haven't really been following, but apparently, there are some silver linings there.
Well, yeah, I wouldn't be too optimistic there, but it might buy us a couple more months.
Yeah, it's not my area of expertise, and I haven't really been following it. But
Yeah, yeah,
anyway, there you go. I think.
indeed.
Yeah.
Well, was there anything else you'd like to chat about? Because I'm about to move on to
Mm,
discussing kind of confidence in COVID-19 evidence, but that's just kind of a
mm.
bit of a lecture. Um, so is there anything else you'd like to chat about?
Uh, not not particularly. I had more kind of morbid anecdotes about how terrible the reception has been to vulnerable people, but I don't really have to share them. Um, so I tell you about the phone call I had from my GP the other day. Um,
You did briefly
yeah,
mention, but do share it with the
so um,
audience.
so my GP rang me and said
Mm,
we have to do a coronavirus care plan, and I thought that's good, that's proactive, and I thought they'd kind of ask me, like which A&E are you planning on attending, just so that they can
mm.
get a sense for numbers. Um, Instead, all they asked me who my next of kin is and whether I wanted to be, um, oh, what's the words? I've just completely lost
Uh,
my train of thought.
DNR,
Yeah, exactly. Whether I wanted a DNR.
do
That
not
was it.
resuscitate order. Sorry for
Yeah, yeah.
non-medicus.
That was the extent of the care plan. It kind of came across to me, and look, maybe I'm perceiving the intention wrong, but it did kind of feel a bit like they were saying, "Should we bother?" Um,
Yeah,
and
and
my
that
answer was,
is,
"Yes, I'm 28. Please do. Please bother."
and it's just that's a very grim thing to be having to answer, especially when as someone who's not even in your 30s yet.
Yeah,
That's
yeah. It's
Christ.
just, it really kind of sounds like the general consensus has been that you are immunocompromised. So it's not unlikely that you would be in serious trouble if you
Yeah.
caught this. So, do you want to die, or what? Do you want to give it a shot? Um,
I mean,
that's
we've got all these syringes and stuff, so I guess we could try if you really want us to, but it's like
it's
Jesus.
it's pretty bad. It's just I don't know. I've kind of felt that way since it all started. Like, it's horrible feeling kind of expendable, but that's what the discourse has been, I think. From my
Yeah.
perspective, I'm sure not everyone feels the same way, but that's my angle.
Yeah, and
Um,
I have heard a lot of vulnerable people giving that impression that they've been kind of discarded in this process to
mm,
save the most people possible, which while is a goal I would laud, I think that it hasn't been necessarily followed in the best approach possible.
Mm. Yeah, I can see a question in the chat about thoughts on the NHS, positive and
Yes.
negative. Um, that's a very, very difficult question. Um, I
Yeah.
it depends on. So I am. I'm not a complete social constructionist. That's not the way I lie. But I am a contextualist.
Mm,
So I think that meanings depend at least somewhat on culture and things like that. So where I'm going with this is specifically that how the NHS does after this will very much depend on social meanings and narratives. So, for example,
mm,
um, let's fast forward 2 months and say that the major kind of media agencies start publishing about how the NHS let us down and too many people died.
mm.
Um, it's plausible. It's not impossible. Could happen. Um,
We have
I
had a
think
death rate above a lot of comparable European countries. Yeah.
right. So if you look at the NHS in from that angle, it could very well be used as an excuse to strip back powers from the NHS and move towards a more privatized system. Better, worse, don't know, remains to be seen. Um, but in terms of the existence of the NHS, it could be a big motivator against it. Point out its inefficiencies, point out that it failed, and then make a
Mm.
very convincing case for a new system. Um, on the other hand, it might go in the opposite direction. People point out that the NHS was the fact that a lot of people survived, and spin it from a positive angle.
Yeah, I
It's
think
yeah,
a lot of it'll probably come down to the impact of whoever happens to be campaigning against the Conservatives,
mm-hmm.
because the presumably the Conservative response will be, as you say, try to spin it in such a way that it looks like the NHS, perhaps the NHS is, not fit for purpose anymore.
Right,
It
right,
needs to continue, of course, it's an important institution, but it needs some extra help from people in our buddies' private companies. I think that's definitely a plausible narrative. Um, Whether or not that holds, I think, is very, very definitely dependent on the opposition, uh, Labour, Lib Dems, activists, etc., reminding people that it was the infrastructure and people of the NHS who
mm,
prevented this becoming even worse,
yeah,
and that part of the reason why it's been the pandemic response in the UK has been poor is that the NHS was operating not that far from capacity in the
yeah,
first place.
yep, absolutely. Um, we have within the NHS like very high continuous capacity. To be completely fair, that's
Mm,
not a scandal in itself, but it's just our levels of capacity are typically very high,
yeah.
which is worrying. Um, there are two specific issues that I worry about in this matter. The first is the kind of moral licensing effect,
Mm.
which I think comes about with the sort of clap for the NHS sentiment.
So
I
just
think it's
for people who might not be aware, do you want to quickly explain moral licensing? Because it's very
um,
important.
yeah. So basically, the idea to relate it specifically to what we're talking about is the idea that people who perceive themselves a certain way, say positively or negatively, um, can then conversely become more likely to. I'm explaining this quite badly. More likely to carry out actions that kind of slant from the opposite moral perspective because they feel like they're good. I explained that really badly. I'm
So
just
essentially,
like,
don't worry. So essentially, the idea is if you commit an act that is widely perceived as being virtuous, and particularly that you perceive in yourself as being virtuous, you are less likely to go on to do more virtuous things because
right.
there's a kind of internal trade-off. Now,
Hmm.
there's controversy over the degree to which this occurs and so on and so forth, but I personally think it's an important psychological effect, and
Hmm.
I think here
Hmm.
there's a very real concern of, well, you continue.
Well, I just worry about these positive actions that are being taken in whatever form, whether that's clap for the NHS or donations and things like that, can act as a buffer against people that then, might want to vote for a party that's going to strip funding to the NHS later. Um,
Yeah,
and it's not an absurd concern. There, as you said, Laurie, there are kind of issues with moral licensing and backwards and forwards arguments about it, but it's possible. Um,
yeah,
and the other issue is just kind of short memories and the fact that people move on very quickly. Um,
yeah,
so I think it's not at all impossible that we could have this kind of very difficult time where people are very conscious of the work that healthcare professionals are putting in, and then in a couple of months, well, it might take longer than that, probably, and it probably will. When things are looking less bleak, people might kind of want to put this behind them and forget about it, and that means that they'll probably forget about lots of different things that they've experienced.
yeah.
That could be an issue.
And yeah, it's not something I know how to resolve. Maybe it's something for artists actually, to engage with and try to
Mm.
create cultural memories
Yeah,
that,
yeah.
remind us why the NHS is important.
Mm.
And I think there is a, a degree to which the NHS can become kind of over sentimentalized.
Hmm.
Um, but it's absolutely undeniable that it's done a lot of good, and that the medical professionals working right now are doing huge amounts of good. And
Yeah, yeah.
though it might not be the optimal system, it might not be the very best possible,
Hmm.
I have zero confidence that whatever the current government would try to replace it with is going to be an improvement.
Mm. To be fair, I believe it's like a reasonably efficient system as uh, sort of national healthcare
Yeah,
services go.
so healthcare economics isn't my field.
Mm.
As I understand it, it's like not bad, but particularly over the well, I was about to say particularly over the last kind of decade or two, it's not been as efficient as many other
Mm.
systems, but that's probably at least in part
Mm.
due to the cuts.
Mm.
Um, but I believe like Germany and the Netherlands both have somewhat superior systems in many regards.
Mm.
Although I'm not expert enough. I'm just chatting shit now.
I
Um,
think that it's interesting because people that work in these systems and politicians and
mm,
people that have a deep knowledge of economics can have these really interesting nuanced discussions about the pros and cons of different systems.
mm,
And the issue is that a lot of the time our take home messages get sensationalized or pushed one way or another. And that's one of my concerns, is that
yeah,
we need to have a lot of very difficult discussions right now and in the future about what we're going to do going forward and what the lessons are going to be. And those discussions are going to be difficult and complex. Um, and it's very possible that the take home messages might be kind of plastered across headlines, positive, negative, whatever they may be, and the nuance is missed out. And I think, frankly, honestly, I feel that's kind of dangerous. Actually, it is dangerous because
yeah,
nothing is altogether, completely good or completely bad.
absolutely. There are
Thinking about
trade-offs
the
in
NHS.
everything.
Right, right.
If you want to increase universality, that comes at a cost of, you know, overall sort of mean efficiency. If you want to increase the range of services available, that can come at a cost of the quality of individual services. It's
Hmm. Mm.
all trade-offs, all
Yeah,
trade-offs.
yeah. Hmm.
Okay, well, yeah. Anything else?
I can't really think of anything.
Okay, well,
Yeah.
thank you very much for coming on. I've really enjoyed this chat, and
Thanks.
I think what I'll do now is I'll maybe see if chat has any questions, anything they want to ask, and then I might go and do the kind of the deep dive in COVID-19 evidence
Hmm.
on Friday instead, because we've already
Cool.
covered a couple of things there,
Yeah.
and also this went on a bit longer than I was expecting, which I'm certainly
Sorry.
not no no certainly not complaining about because that was a really interesting question. We kind of blazed past the rough notes that I had, and yeah,
Yeah.
really interesting conversation. So thank you very much indeed, Ollie,
And
and
thank you, Laurie. It's been a pleasure. It's been a real pleasure.
absolutely. If you got anything you'd like to plug, I can't claim that my viewer base is
No.
massive, but
No, no, I really don't. Um, Maybe read my paper if I ever publish. It's coming. It's coming.
I will I will happily post the paper on all my social media when you do, because
Thank you.
I'm always up for sharing friends' papers.
Cool.
Um,
Thanks very much. It's been great to talk to you.
yeah, you too. All right, take it easy, man. See you.
See you.
Bye. Ah, lovely. Yes, fire indeed. Ollie is a jolly good chap and thoroughly interesting, and yeah, always has really good, well considered takes. I was lucky enough to meet him when we were at university. I think I'd just started my masters or was just about to, and a very good, very old friend of mine invited him into our D&D game, and we've been solid friends ever since. Ollie played Eshk, the halfling fighter with a Mangalitsa pig that he would ride around called Paish, and he won a jousting tournament with on the back of Paish. Um, yeah, so any questions from chat? Anything you'd like me to pick up? Um, yeah, it was wonderful, Ollie. Thank you very much for popping on. And yeah, like I say, the kind of deep dive into the evidence stuff, um, that's going to take me a while, and I'd like to kind of devote a full stream to that. Um, though we'll just say something that kind of was touched on there, um, that I think is worth discussing is this issue of longer term side effects. Um, so, unsurprisingly, uh, lung scarring is a potential risk. There are these neurological complications that we were discussing, potential neurological complications, I should say. There is acute and long-term, potentially acute and long-term implications for the cardiovascular system. This paper, obviously new, but so is everything, indicates that maybe there could be some long-term uh, damage to the heart, and potentially, so there have been some observations of coagulopathies, which is inappropriate thickening of the blood. Um, I don't say this to be a fear mongering or try to scare people, because it seems like, particularly with the milder cases, uh, there aren't any serious long-term complications that we've been able to like definitively identify so far. But the reason I bring this up is that so much of the focus about COVID-19 is purely on these death statistics, all of the graphs showing uh, here's our death curve and X many people have lost their lives as a result of this, and Y many will in the future unless we do this intervention, and excuse me. And the fact is, with any serious medical condition, deaths aren't the only thing you're worried about. You're worried about the long-term effects on people, the effects of treatment, side effects of the treatment. We've seen uh, hydroxychloroquine, and I mean, all of the anti-malarial drugs, basically anything based indirectly on quinine, is going to have some potentially quite nasty side effects. Um, hydroxychloroquine is admittedly relatively mild within that class, but it's very much like a relative thing. Um, the effects of intubation can cause long-term damage, and with a myopic focus on purely who lives or dies, it doesn't capture the extent of possible harms that a condition can cause. So it's something that I think is worth considering whenever we're just talking about reducing the death rate and talking about, infection fatality rates and case fatality rates. That's really not the only metric of how bad a disease is, unfortunately. Um, so yeah, it's a concern, and like I say, we touched on that earlier, so I think that's worth discussing briefly. I'm going to wrap it up there. Uh, but if anybody has any comments or critiques or questions or anything like that, please do get in touch. I am available on uh, YouTube and Twitch here under Post Normal, and you can find me on Facebook or yeah, just hit me up wherever. And let me know if you've got any ideas for future streams or anything like that. I do have quite a lot of ideas I already have planned, but I'm always interested in more. So yeah, thank you very much for watching. Again, decent, not terrible number of viewers, and I appreciate every one of you. And yeah, have a lovely Wednesday evening. Oh, before I go, some exciting news. I've spoken with a couple of friends of mine, a couple of, well, a very capable scientist and entrepreneur, and a wonderful philosopher who I will hopefully be having to guest star on my little stream in the near future. So stay tuned for that. And yeah, thanks very much. Have a good evening. Stay safe, everyone.